Welcome everyone. The Center for Food Allergy and Asthma Research, CFAAR, presents Allergy Insights 360. Allergy Insights 360 is a discussion series exploring life with food allergies and asthma from different perspectives, helping families to learn and live life with confidence. In this discussion, we'll focus on navigating the aftermath of anaphylaxis. The goal is to share insights on anaphylaxis and its potential impact post-reaction on the mental and emotional well-being of people with food allergies and their families by presenting CFAAR research and lived experience of those impacted by food allergy. Viewers will hear from a young adult who has experienced anaphylaxis many times, a parent whose child has had numerous anaphylactic reactions, and a clinical psychologist who helps families find their way through the mental and emotional aftermath of a reaction and conducts research on the psychosocial impact of living with food allergy. So who are today's panelists? Our first panelist is Justin Zaslavsky. He is our teen young adult who has experienced anaphylaxis. Justin was born just north of Chicago and lives now in New York City. He has food allergies since childhood, specifically to tree nuts, sesame, and chickpeas. And he's outgrown his pineapple and peanut allergies. He attended Tufts University, where he studied community health and philosophy and conducted research on food allergies. After graduation, he participated in the New York City Urban Fellows Program. After Justin's fellowship, we were fortunate to recruit him into CFAAR to help support all the research we have ongoing with the Food Allergy Research and Education Organization. Our next speaker is Jennifer Solomon. She is a parent of a child who's experienced anaphylaxis. As a mom of an 11-year-old with severe dairy allergy, Jennifer has experienced the panic and anxiety of anaphylaxis more times than she'd like to count. She's become familiar with managing the health and emotional crises during an allergic reaction, and also long after the immediate crisis has subsided. Those experiences influenced her decision to become a therapist. Prior to entering the mental health field, she worked at Food Allergy Research and Education to educate the public about the gravity of food allergies. Jennifer joined CFAAR's Community Advisory Board in 2020. And last but not least, our third speaker, Dr. Lisa Lombard. She's a clinical psychologist and a research assistant professor with us here at CFAAR. Lisa believes in the translation and dissemination of research-based information to offer interventions and self-directed practices that support behavioral health. In her clinical work of over 30 years, she integrates mind-body practices for children, families, and adults coping with anxiety, stress-mediated health concerns, and pain. At CFAAR, she studies psychosocial coping with food allergies, with plans to develop and test interventions to support children and parents managing food allergies routinely, as well as during desensitization treatments. She earned her PhD in psychology and human development from the University of Chicago. We're going to start with our research at CFAAR by describing the current prevalence, number of reactions adults and children are experiencing, and the psychosocial impact. So childhood food allergy prevalence. Now, this is a study we published last year where we found that about 8% of US children have food allergies. That's about 1 in 13 or 2 in every classroom. Additionally, 40% of these children are allergic to multiple foods. An additional 40% have experienced a severe reaction. Now, these are the top 9 foods kids are allergic to: peanut, milk, shellfish, tree nut, egg, finfish, wheat, soy, and sesame. What this describes is how many parents reported their child having a food allergy, which was actually 11.4%. What we found to be convincing food allergy, which was around 8%, and really points out that only about 5% of these kids are getting a diagnosis. So really encouraging all of you to make sure you get to an allergist and get diagnosed. We recently published this paper looking at FAAR's patient registry. There were about 4,000 respondents, and what we found is that the majority were having more than one reaction per year, especially in adults. So if you look at each of these, about 46% of caregivers reported less than one reaction a year in their child, and only about 30% of adults reported less than one reaction a year. One per year was about 14% in children and 10% in adults. And then more than one a year, look at this, about 1 in 3 children are having more than one reaction every year. And over half of adults are having more than one reaction every year. So this is really significant. So having a food allergy, what does that mean? It means that the majority are experiencing at least one reaction per year. Now, what do these reactions look like? Again, this was reported by either a caregiver or an adult with food allergy. And what we found was that 3 in 5 of respondents' most recent food-related allergic reactions were moderate to severe. And nearly 1 in 4 most recent reactions required treatment using epinephrine autoinjector. So in our larger prevalence survey, we asked about emergency department visits for allergic reactions. And caregivers reported that in their child's lifetime, 42% of them had visited the emergency room at least once for an allergic reaction. And more importantly, 1 in 5 caregivers were reporting that they had visited the emergency room in the past year for an allergic reaction. Now I'm going to turn it over to Dr. Lombard to talk more about the psychosocial impact of food allergies and anaphylaxis.
Thank you so much, Dr. Gupta. I appreciate you providing the context for how to look at the psychosocial impact of food allergies and specifically the anaphylactic reactions that we're talking about. What we've recently done is surveyed caregivers and about their children to learn more about the emotional responses that both the caregivers and the children have to having a food allergy. And I draw your attention to some that we now know, and really it's common knowledge that anxiety and feeling scared are the most prevalent among the caregivers, and they're also prevalent among their children. But if we also look, there are some differences, and I draw your attention to those differences because it's an important nuance to think about where parents and children are the same and where they might be different, so that we can craft interventions and support that really address these differences. I think what we see is that the emotions that have an asterisk show that there is a significant difference between the caregiver and the child's responses emotionally. And so we can look at a few that we're not necessarily as, excuse me, we can look at a few that we're not usually focused on, like being preoccupied. And we see that parents have a significantly higher level of being preoccupied, that is thinking about the food allergy compared to the child. We also see that a reverse is indifference, that caregivers are reporting that their children are significantly more indifferent about the food allergy than they are. So recognizing that there's a spectrum of emotions, and not just that there are different emotions for food allergies, but that caregivers and children experience it differently, I think is quite important. Then we've looked at that data and really zoomed in on what it's like to be a caregiver and a child who've had an anaphylactic response and needed to use an epinephrine autoinjector within the past year. And we see that there are also some differences among this group. So we see that for children who have used an epinephrine autoinjector pen within the last year, their reaction, their feeling of being insecure is significantly greater than children who haven't used an epinephrine autoinjector within the last year. And that's the bar that has the asterisk. But beyond that, there are a couple of emotions that are also approaching that level of significance. And we can think about it clinically and in terms of the lived experience. We see that feeling overwhelmed and feeling helpless are the other two emotions that kids who have used an EpiPen are feeling in comparison to kids who haven't used an EpiPen. So thinking about that emotional impact of anaphylaxis, it's sort of a triad of being insecure, feeling helpless, and feeling overwhelmed. And I know you all recognize that that's not the position that we want our kids to be in.
That's so interesting, Lisa. I just wanted to point out there that there's such a fine balance because sometimes we think using epinephrine will make them more confident that they can resolve
Right.
their allergic reaction. And yet also it instills the fact that, wow, I had a severe reaction where I needed it. So a little bit more of the fear. So that, I
Right.
don't know what you think about that. Yeah, that fine balance.
Absolutely. Absolutely. Thank you. Um, so the previous information about children is also interesting when we look at it in the context of how are adults with food allergy and anaphylactic reactions faring. And we see that the factors that are most strongly associated with worse quality of life for adults are treatment in the emergency room, having a current epinephrine prescription, and using the epinephrine. So those are those things, again, just like we saw with the children, it's actually the use and the adjunctive trip to the emergency room that is associated with a more difficult quality of life.
Thank you so much, Lisa. Now we'll go into our discussion of the lived experience and understanding from a young adult and a parent of what that really was like in their personal lives. So, Justin, we'll start with you. Did the aftermath, did the severe reaction change the way you lived your life and went about your day? And can you tell us a little bit about some of those more significant reactions that had an impact on you?
Yeah, sure. I listen. I felt very seen in Lisa's slides. It's really always interesting to see the data that kind of can speak to the lived experience of myself and presumably so many. Um, I think the acute aftermath undoubtedly changes the way you think about things, as any emergency room visit I imagine would, and you're definitely feeling a little more hypervigilant than you might, have been or you were in the circumstance that got you there. I think in the immediate aftermath, I took it as an opportunity to make sure that all my epinephrine auto-injectors were, up to not expired and in places that I, regularly had them. I think as happens sometimes is, people are not, I found myself in situations where my epinephrine auto ejector was not as accessible as I know it should have been. And so you have to know yourself and you have to build your safeguards. And to do so, I made sure that I had them in places, my backpack, at home, at school, places that I knew I would want them handy if I were to, while of course doing my best to remember and writing notes to myself and whatever else. Um, but yeah, I think it did in the immediate aftermath change the way I felt. And, there's a fear and an insecurity, I think, and it makes sense you stratified based on whether or not you've had to use an epinephrine auto-injector in the past year, because it does certainly change the way you think about things. And what's tough is making sure that vigilance maintains.
That makes so much sense. And full disclosure to everyone listening, Justin experienced an anaphylactic event in our office, and I got to be in the emergency room with him. And maybe if he is okay with it, we can pull up a photograph of that emergency room visit. So it was, it was something that our many people who were working at CFAAR got to also experience with Justin. But definitely an experience that taught all of us a lot.
Yeah, and it, but again, it reinforced the need for those practices that people who live with food allergies, need to think about all day, every day. And it's interesting, Jennifer, I'm curious what you think too, just given the, you know, distinct results based on caregiver and child, because I do feel that way as well. And that it is a different experience if you're the one, if it's, of course it's as ubiquitous for the parent as it is for the child, just how, that relationship works. But it was really interesting to see. Thank you, Lisa, for sharing those data.
Yeah, absolutely. And Jennifer, as a
Thank you.
parent, being on the other side, a parent of a child, if you could give us a little bit of your perspective, how old was your child and what did you feel in that aftermath?
Sure. So my son Luca is 11 years old. We've had many reactions along the way from when he was, 8 months on, more times than I like to count. And we have had several hospital visits and a couple of overnight stays. So we've definitely been in the trenches. Um, you know, what I see in him is sort of this increased cautiousness, right? Immediately afterwards, just a heightened sense of worry and fear. And for me, massive anxiety. And I think, what we're talking about here is sort of how do you contain the parental anxiety and not project it on your child, which is really hard. And Justin, I'd be curious to hear how, if you're with your parents, if you saw some of that from the child's perspective. My guy's a little young, so we haven't really talked about that piece of it. But I think, you see afterwards, a lot of, is this safe? Can I trust this situation now? Are you sure? Are you sure? And then a lot of me feeling that exact same feeling. It's really, in some ways it's not that different. I think that I would sit with him a lot and say, yes, it's safe. Let's look at the ingredients together. It's sort of like rolling back what you already do, sort of what you learned to do, and doing it all over again and starting a little bit from zero. So lots of label reading and lots of need for reassurance and safety on both of our parts. So I think it's really a matter of like building confidence back up after a reaction.
Absolutely. And you pretty much answered my next question I was going to pose to both of you, which is, but if you have anything to add to that, because I think this is really important for viewers, is, how do you regain that trust and confidence, after a reaction? And that's what you mentioned, a couple of things, label reading and, just being more vigilant. And Justin, you mentioned making sure your epinephrine auto injectors were not expired and you had them in places and you wrote yourself notes, which are all super important. But anything else that helped you regain that trust in your own ability to manage your allergies, Justin? And then, for Jennifer, kind of how you encouraged your child after that to regain confidence and decrease their anxiety.
Yeah, I was just gonna, I think Lisa was exactly right. There's a degree of insecurity you experience after reaction. Like, how am I foolish enough to let this happen? It's not like I didn't know that this was an issue, and that I didn't, did I not ask enough? Or oftentimes, unfortunately, what happens, even the person you asked didn't know, and there's cross contact and whatever else. And so to your point, I think the first step is kind of stepping away from that judgment and like holding some self-compassion and recognizing that you're doing your best and what you eat is like the most intimate experience you have as a person, and just not villainizing that, I think, is really important for anyone with food allergies. And that's hard to do when there is a narrative of fear as exacerbated by a trip to the emergency room. And so I think being intentional about thinking about that and holding that space for self-compassion and, recognizing or, getting a little cognitive and really trying to challenge that judgment that you might feel for yourself, and then finding the grounding in the support system that I, have remained lucky enough to have, and people who I know care about me and access to the medication that I would need to be safe and et cetera. But I think, time heals a little bit, and making sure that you continue to surround yourself by, the people that help you do so was kind of how I helped regain trust and confidence in this, not that I lost it in other domains, but with this one, it's important to build back.
And I just want to piggyback on what Justin said, because, a couple points he made, some of the research that he actually also helped us conduct after this episode included that over half of people who have allergies and even a prescription for epinephrine are not carrying it with them. So, this is additional data that we'll include for all of you, because it would be interesting to see. And, what we understand is that, the longer you go without a reaction, time makes you forget and you're not as vigilant. And then, a couple other important points that I want to bring up just as Justin's listening is another study we did with young adults. A couple of the really positive things that came out of having a food allergy were the fact that they were reporting that they are able to self-advocate for themselves, which I know Justin does, and a lot of people listening and your children will start to do, and it's an important characteristic. And the second one was they empathized with others who had something, because everybody has something. And so to instill that skill of advocacy and empathy in our children is a really positive thing.
Yeah, I would the building confidence, I'm with you, Justin. I think there's sort of two parts, right? There's the logistics, like, okay, how did our plan go? What do we need to change in terms of what we do? Do we checking EPIs? Where are they? Did we use it quick enough? There's sort of those things. And I think that helps build confidence. And then there's the emotional side, which I think is about sort of focusing on what can we control? So we can't control all of the accidental ingestions, right? Those things are going to happen. And I think accepting that is part of what we need to do. But then focusing on what we can control, and what I feel like we can control in the reaction is we can use epinephrine. And I know that sort of flies in the face of the data because we're increasing, and there's all these kids that feel more anxious after having used epi. But what we do know is that knowledge is power, and that epinephrine works. So in terms of building confidence, I always like to tell my son what we did worked, right? We did the right thing. We know what to do in this situation. And I think that that's the piece of control where kids can feel and parents can feel like, I know what to do.
Right. Exactly. I love that. And two additional things that we talk about is role playing with your child after that, and just thinking through scenarios and what are the right words to say. Maybe you didn't ask because you were, nervous about asking, which is okay, but like, how would we do it next time? And then doing a lot of role playing with using epinephrine to take that fear away. Other studies have shown, and they're usually during having oral food challenges, that having an oral food challenge, now that's in a controlled situation with an allergist present, that actually, when they use epinephrine, it improves their quality of life, and in a way, because they know that they can and they'll be all right, and they've used it and they realize it doesn't hurt and it actually makes them feel better. And so that whole needle fear, but obviously if you have a reaction and you're hurrying and you're scared and you use it, it may improve your confidence in being able to use it, but it's still going to cause that insecurity of having a reaction, outside. So just to bring that up too, just know that using epinephrine, and if you are able to, then it has been shown to increase your confidence in the future to be able to use it and feel better. So even role playing using epinephrine, on oranges or grapefruits, with expired epinephrine, we highly recommend.
Yeah, I really agree. I think knowledge is power, to your point. I think they come with trainers for a reason. You should use it. You should show your friends how to use it. You should take expired ones and put them in fruit. I agree though, and just knowing that it works, it's pretty good at what it does, really does help build confidence.
I think another important thing about building confidence is not pushing too hard on your kids. So as the parent, you want them to get back to normal.
Yeah.
Right? Like it didn't happen. Everything's okay. Eat normally. And I've seen in my son, he pulls back a little bit. So I said before, he talks about, is this safe? Is this safe? He might not eat as much. He might want to stick with some really simple foods, sort of forget the adventure, leave that behind for a while. And what I've learned along the way was not the first time around, but over time, learn to let your child sort of dictate the pace, both in terms of eating, and obviously I'm sure Dr. Lombard can speak to when that becomes a problem, but to not push and let them sort of follow their lead and what they're comfortable with. And for at least what I've seen is that then things do resume to more normal, but not immediately, and that's okay. And so I think that is something that's taken a few years to learn, but I'm getting better at it.
Well, thank you for pointing that out, Jennifer, actually, because what you just described is that you've provided your son with an opportunity to regain some control and some sense of self-efficacy through that. So the pacing that you're describing with the reasonable caveat that if it starts to interfere with his nutrition or behaviors, there's a concern. But when it's simply a matter of you mirroring back to him, he can do it at his pace and you're going to be there to support him. That's a really wonderful example of the dance that the parents and children can do around this. Absolutely.
And again, full disclosure, I too have a daughter with food allergies and have experienced exactly what you're talking about, Jennifer, and that fear in them that comes immediately after, and pulling back and just going with trusted foods. And I think that is an important part of this. And how do you do that? And then a little bit of dependency on you, a little more, right? Like to keep them safe. And how do you get out of that? And Lisa, maybe you can talk about that. But some things I purposely did, where I would be reading labels or she'd ask me if it was safe, and I would purposely misread. Now, I wouldn't let her eat it, but I would purposely misread and say, can you just double check it? Because it's really small and mommy can't see that small. Her eyes are getting old. And then when she would read it, she's like, Mom, you missed this. And it just like, I don't know if you have other little tricks to just give them the confidence in themselves that I don't have to depend on Mom because I can read better than her, and
Right.
things like that. But like tips and tricks, because they do then feel that. And I want to get them back to, there's a comic that I love that's in our book where sometimes as a parent, a kid came home from school and said, Mom, I'm so excited. I met a kid just like me today. And the mom says, oh, really? They have food allergies? And the kid says, no, they like soccer. And it's that feeling of you are a whole. And, we often, that's like the first thing our mind goes to, but, the kid themselves has, so many other things, and this may be, smaller. So I'll stop there, Lisa. I'd love to hear your thoughts, and Jennifer and Justin, any more you have.
I think this is a terrific conversation. I think that you're talking also developmentally. So Dr. Gupta, you're explaining that for your daughter, for her to take ownership of this a little bit more and maybe even to surpass her mom, which is an age appropriate thing to do at certain developmental points. That gave her something that she was looking for and that she could use to rebuild that confidence. And you were giving her the space to practice. We've been talking about different ways to practice. So there's the physical practicing with a trainer, which is a great simulation for desensitization, right? The more you do something, the easier it gets. And our kids, our kids know it, and we as caregivers and adults and parents are always saying it, right? Practice makes progress. If you want to be a good soccer player, you have to practice. If you want to be a good mathematician, you have to do math problems. So similarly, if you want to know how to use this, you have to practice. And it's a great tool. And so it makes sense to me as I was listening that individuals' level of confidence would go up because there's mastery there. And when you can master something, it's great. When there's a long span between episodes, what you were saying, Justin, you kind of forget, you kind of don't have sort of the edge anymore. And both your fear might go up because it's been so long, and your skill set might go down. So that becomes, unfortunately, a recipe. So all throughout this, we're talking about what's that balance. We can call it sort of, how to integrate a certain level of awareness, even vigilance at times, with a certain level of let the kids learn more and more on their own. But as with all parenting steps, we have to be mindful of safety. So you don't want your child to learn how to cross the street by saying, go run out in traffic. You have to teach the skills. And this is likewise, what you're doing is teaching. But to be respectful, as Jennifer, you point out, and Justin, you've experienced, you can know it all. And there are certain uncertainties in the world that just exist. And so you are living with an undercurrent of apprehension, of anxiety. Anxiety lives on uncertainty. And because you're not in the factory producing the food or in the kitchen making it at a restaurant, there's a level of uncertainty. And it's how do you minimize that while you maximize your skill set through gaining information and competency with using the tools and keeping your EpiPens nearby and so on. Yeah.
And then the one additional thing, and I'm going to go into the last questions. I mean, we could talk about this, I know, all day, but you know, the one feeling we haven't really talked about today, which I know I experienced, and I feel like, you know, Justin, you may have when you've had these reactions, and Jennifer, I'm sure you have, but I really want to point it out to the viewers because I think one big experience when your child, you know, does have an allergic reaction is the feeling of guilt, right? Like, why did I do that? Why did I try that food? Why didn't I read it more carefully? Why didn't I ask twice? Why didn't I protect my child? How could I not have protected my child? And I just want to say to all the viewers, I feel like that's kind of a hidden feeling that you just carry with you, and you know, it is something that we need to let go of, because reactions, as you saw, over half of people with food allergies are having reactions. So this is not something you did or you caused. You know, it's something that is occurring with everyone, because it is so challenging, and that is the issue with food allergies. It's so challenging to avoid that food. So if I can tell you one thing, if there's one thing that I've worked hard to get over, is that feeling, you know, of guilt from, you know, accidentally, you know, doing something that caused that reaction. I do want to go, Justin and Jennifer, to you all one more time, because, and then I want Lisa to close up with some tips for all our viewers. But Justin and Jennifer, like, what do you have a tip that you know, Justin, to the kids watching out there who may be experiencing allergic reactions, kids, young adults, college kids, you know, anyone out there listening, is there any 1-2 tips that you would want to leave with?
Yeah, I mean, I think nothing that hasn't been covered, but you know, it's just important to ground yourself in what makes you feel safe and what makes you feel good, and you know, of course, recognizing the, you know, the morbidity. It's you know, the danger that exists around experiencing anaphylaxis and you know, having an allergic reaction, while also knowing that we're all doing our best, you know, and as you said, a lot of people have allergic reactions, and that is a part of living with food allergies, unfortunately. And every day we're shaping policy and we're trying to advocate for ourselves to make that happen fewer and fewer, but just ground yourself in who you are and how smart you know you are and all the things, and you'll wake up the next day and continue doing your best, you know.
That's awesome.
I'm Copeman.
I love that. I love that.
Beautiful.
I think I'd go back to what I said before, is just be mindful of your own anxiety and not to project it onto your child, so that what you're feeling is not necessarily what they're feeling. And so I think you just have to be careful of that and contain it, because you're the adult who's got to model, right, how your kid reacts. And I'm with Justin and Dr. Gupta about, like, let go of the guilt and be kind to yourself. Focus on what you did well. You know, what worked there. Again, we do have some control. We don't control the thing that we want to control the most, which is avoiding any kind of reaction, but we do control what we do. So I think, you know, when mistakes happen, assume that they will happen, and feel confident that you know what to do. And if you would change something, then you have the power to change it the next time.
Perfect.
Absolutely.
All right, Lisa.
Thank you. Yeah. So Jennifer and Justin and Ruchi, you've all anticipated some of what I'm going to talk about related to some perspectives on coping. And I look forward to really sharing how to look at the parent-child relationship, which you were talking about so much, Jennifer, and the matter of perspective. We're going to talk a little bit about that. And then also focusing on shifting the narrative. And I heard you earlier, Justin, talking about the narrative. And really, there's some great work being done by psychologists in the pain world about shifting the narrative. And I think that has a lot of applications for people with food allergies as well. Next slide, please. So as we've been talking about, there's certainly typical and expected normal or natural reactions after having experienced anaphylaxis and using an EpiPen and potentially going to the emergency room, although it really varies widely. But certainly that recognition within the family that something out of the ordinary has happened. And therefore, we are all going to have some out of the ordinary experiences or reactions for a while. That's a really normal response. It's not every day that you have a medical emergency that requires this sort of treatment or trip to the hospital. But for the most part, pediatric patients and their families do well with this. On the flip side, the areas where it clearly starts to become a concern is when it reaches a level where it interferes with daily life. So when you're not able to do the things that you want to do from the perspective of the child, or maybe from the perspective of the family. We can't go to grandma's house. We can't go on the picnic. We can't go to the movies, whatever it is. And in that situation, the anxiety is starting to really interfere. I think a few of you have mentioned some reluctance to try new foods, and that's again a spectrum. That's natural when it first happens. You might stick with your tried and true foods, but later you want to encourage your youngster to regain some of that curiosity and adventuresome. Excessive worrying, and we've talked about that as well. The what ifs, what if this does have peanuts in it? What if somebody wasn't telling the truth? What if the label was wrong? And again, we're looking for the balance between reading and taking care of oneself and not overextending that anxiety. Sometimes if you notice that your child is starting to have more of a generalized anxious worldview, I don't want to go out, I don't want to leave the house, I'm not comfortable going to school, those are areas where you might begin to be more concerned and think about whether or not the anxiety related to the anaphylaxis has kind of seeped into other areas of life, and you might want to consider seeking some support from a mental health provider. Next slide, please. When it is an area of concern, we can really start thinking about whether or not this was a traumatic medical stress or stressor. And what we know about medical stress and traumatic stress is that the three key elements are the re-experiencing element. So is your child going over and over the details again? Is it hard to stop thinking about it? Are there little reminders where the child will say out of the blue, oh, yeah, that was the car that we drove in when we went to the hospital, or she reminds me of the lady we saw there, or, just things that really are out of context and indicate that the child is re-experiencing and more highly focused on it. Avoidance, which we've talked about quite a bit, of avoiding foods or places or experiences. And then this third area is really interesting. It's hyperarousal. So the idea of an emergency and the anaphylaxis itself, and then the anxiety, all three of those things actually cause our bodies to go into high alert, right? Fight or flight. And that's very uncomfortable. It's good when it's a signaling mechanism. We need some amount of arousal in the world at large, but when we can't turn the signal off, when there's not an all clear signal that we can offer the child, and the child is stuck, or the parent is stuck in a hyper arousal of even small things elicit this reaction, that's another level of concern that indicates some support might really be useful. Next slide. Sorry, as was mentioned, the use of an epinephrine autoinjector is an opportunity for positive coping. Linda Herbert and Dr. Gunn-Galvin in Europe have really been doing some studies that are looking at what are ways that using epinephrine can support positive coping, and thinking about and modeling the balanced integration that's necessary. From the interviews that our team conducted with allergists, we know that the allergists are really mindful of how to navigate post-reaction anxiety. So we asked the question to them of how do they counsel their patients after using epinephrine or going to the emergency room, and they're really keen on these three things, which are a thoughtful and balanced communication relationship with the child and the family, being sure to share credible, vetted health information with children. I mean, it makes complete sense. We really like to know what the facts are about an illness or about a problem. And so share with the children at the appropriate developmental level what they can understand about their food allergy or about how epinephrine works or about what the risks are and the cautious behaviors that they have to take, and make sure it's from a credible source and not from Dr. Google, essentially. And the third one is recognizing that there is this feedback loop between parents and children. And Jennifer, you really were highlighting that, and Ruchi as well. And I appreciate your honesty about it, thinking about, kids look to parents. So if we look at the next slide, we want to think about what this feedback loop might look like. We have an illustration. Two girls have fallen. But I suspect if you look at them, you would think that the parent would probably react differently to each of these falls. The parent of the girl who's wearing the pink knitted hat might be a bit more upset and worried and come running over because it really looks like she's in distress. Whereas the girl who's got the helmet on, protection, and she's fallen and she's smiling and she's looking up, yes, she's fallen, but that might be the parent who can say, oh, you got this, you can get up, come over to the corner and meet me there. So your reaction is going to be different, and kids are always looking to it. Next slide, please. And in fact, we know that what we magnify, we know that what we focus on, we magnify. So this is a cartoon, and this woman has done a performance, everyone is applauding, and there's one person in the audience who has his arms folded. That's what she's noticing, and she thinks to herself, they hated me. And so we have to be very aware that if we magnify all the things that went wrong when there was an anaphylaxis, an anaphylactic reaction, I'll get it right eventually. When we only noticed, it was, oh, I should, all the should-haves. And I think that goes to the guilt that we've talked about, right? I should have read that 3 times instead of 2 times only, or I should have never gone to that store, or I should have prepared this meal differently, or told the parents in advance at camp that we couldn't do this. When we focus on it, we really enlarge it and magnify it. But there's a lot of other things that are going on that are adaptive and positive. Next slide, please. So I am encouraging us to practice. The tip is really to practice shifting perspective. Here, the waiter comes over to the table with 2 glasses of wine. Okay, now who ordered the glass half empty and who ordered the glass half full? And so we have to shift our perspective to see that some things worked well. You had your EpiPen with you. You had it in 5 locations, Justin, whatever it is. You knew to call the neighbor because mom wasn't home. Like, there are things that just really did work, and let's focus on that. Next slide. I really just love to re-emphasize this message. I do this all the time with kids in my private practice. Which one are you? It's the same glass of water. It's a hot day, and you get half a glass of water. Are you going to complain and say it's only half a glass? Or are you going to say, wow, this really made me feel better because I was so hot after playing outside? It's the same event. It's the same glass of water, but it's how we look at it. Next slide, please. So the hard part, though, of course, is when we look at things like this, we do get aroused. You might already be noticing when you see the word emergency room, or you see a needle, or you see epinephrine, adrenaline, you're going to react a little bit, and that's natural. But the question is, how can you be aware of that, be mindful of it, as we've talked about, and shift the perspective enough so that your child can start to grow that confidence? I think there are a few additional things to integrate into the whole treatment of individuals who've had an allergic reaction and have used EpiPen and have gone to the emergency room. And so I'm going to show a couple of slides that hold some promise and some opportunity to build. So if we can have the next slide, please. This is a tool that comes from actually CHOP, Children's Hospital in Philadelphia, and it's related to kids who've been in the hospital because of a traumatic medical event, and afterwards they can write the story up and indicate what has helped and what hasn't helped. So it's not the text on the left that is appropriate for food allergies, but it would be a great model. And I think thinking about things as, is this a distress narrative or a resilience narrative, can be very, very helpful when we're talking to kids or working with individuals. And so a tool like this could be adapted to emphasize the resilience, which is usually the positive emotions related to it, and the sense of confidence and closure that you had, as opposed to distress, which is related to the negative emotions and all of those unanswered questions or what if questions that simply exist. As we've said, these things are happening to over half of the population with food allergies. The model of distress or resilience narratives is coming from psychologists who are working in the pain field. Melanie Knoll in Canada does a lot of work with these narratives, and I think it's really quite a rich area to pursue. And then the next slide, please, is another illustration of a tool, again, at Children's Hospital of Philadelphia. And it's little Post-it notes, right? And I just love Post-it notes. And you know, it could be have your kid write a few things about what worked, right? And kind of keep it somewhere could be in a journal or it could be on a wall somewhere. But again, it's what went well and how can we talk about it from a resilience perspective instead of a distress perspective. Next slide. I don't know if there's. Yes, thank you. There is one more. And so thinking about, you know, building that resilience and coping, again, this is from a recent survey that we've collected information on caregivers and their children and those who've used the EpiPen within the last year. And what coping skills are the kids in particular interested in using? So the kids who've had more than one Epi use in the past year, according to their caregivers, they would be most interested in meeting individually with a mental health professional. So seeking some kind of sounding board platform to talk about what has happened, maybe to do some skill building, which is also a component of working with a mental health professional. And then the others really seem to fall into this area of helping to lower the distress a bit, right? So it could be guided imagery, it could be learning self-hypnosis, it could be muscle relaxation, it could be mindfulness, all those kinds of practices that we know are really good at modulating and reducing stress. And so this was a stressful event. How can they help manage their distress and build the resilience narrative? Through working with someone as well as learning some self-directed skills. And it was really fascinating to see just how much there is a need for this. And unfortunately, there's also a segment of our families and all of us where really we don't know what would help. And so if you look at the two right-hand bars, none of these is still fairly high, right? So people are very much looking for ways to manage the social and psychosocial and emotional fallout from using an epinephrine auto-injector, having an anaphylactic reaction, going to the emergency room, and then that family story that persists. You know, I think that not meaning to highlight the negative, but you know, people, parents and adults will say, they'll start off the conversation, remember that time you were in the ambulance or you almost died, or I was so scared. And that's what sticks with kids. So we're working on shifting that. And I think this conversation and this set of data is a really wonderful opportunity to get the shift going. So I appreciate everyone listening. Thank you.
Thank you so much, Lisa. Those were very helpful tips and advice.
Good.
And to Jennifer and Justin for all your honest and experiences and all your advice also to our listeners and viewers. I want to end with letting the viewers and listeners know that you can get a hold of us, and we do have resources to share with you. Here are all our handles or ways that you can reach out to us. We will also, along with this video, be sharing some of these papers that we talked about if they would support you, and we can share the PowerPoint if any of this data will help you teach to others. You know, one of my favorite quotes is from Maya Angelou, and it says, "When you learn, teach. When you get, give." So please do share this information with people who you know can use it, and you know, please ask them if they would like to be a part of our CFAAR community as well. So thanks again for listening, and until next time.